Welcome to Willamette Health Partners Comprehensive Pain Center. Our goal is to provide a tailored treatment approach that includes traditional and non-traditional methods. Implantable devices to control pain may be a good alternative. Spinal cord stimulators redirect painful effects. Pain pumps improve the delivery of medications.
If we take an example of a patient who has damage to their spine, and initially the source was identified to be a disc problem, and they had an operation on the disc, and for whatever reason the operation was not successful, whether it was successful initially and the pain came back, or just was never helpful with the pain, or it was accompanied by more irritation of the nerves. So we reached to a point where there's not necessarily a cure for the pain, because even though initially there was a source, now that source is not something that we could fix per se. So if the pain is bad enough and they've exhausted all their options, we use different tools to mask the pain or override the pain. One of them is to use electricity. The way it works is by providing a different sensation to the nerves that are causing pain. In this case, it would be a vibration or tingling, which is produced by the electrical stimulation to override the pain sensation. So the stimulators are implantable devices. There is a trial period first to see if they actually work or not for a particular patient. But if successful, they are an implantable device, just like a pacemaker. People are familiar with pacemakers. So we call them pacemakers for the nerves. And they are used to override the pain signals.
Pain pumps are implantable devices that deliver pain medicine into the central nervous system. So it has two parts, a reservoir and then a catheter. The reservoir holds the medicine, and then the catheter transfers the medicine from the reservoir, from the pump, into the area around the spinal cord called the intrathecal space, the fluid space around the spinal cord. So when you take a pill, only a small fraction of the total dose of the pill will reach its target. But also that means your blood levels are going to be high, and you get a high side effect profile from that. So by taking the medicine and delivering it right where it needs to work, then you only need enough to affect the receptors there. So you need a very small dose. You need a scale of 1 to 1,000 between the pill and the pump. And then that gives you a lot less side effects with better efficacy.
Regardless of the intensity or frequency of your pain, if it limits your life in any way, you may benefit from a consultation at the Comprehensive Pain Center with a referral from your primary care provider or specialist. We can work with you to improve your quality of life.